Thanks for your speech, Minister. Thanks for taking our questions. The Treasurer regularly cites health and aged care as two of the biggest pressures on the federal budget, along with repaying debt, the growth in the NDIS, defence, things like that. Is that inevitable going forward in an ageing society like Australia, or will there be changes to spending in the health portfolio to manage that in a better way?
Well, both. It's not an either or. There are some areas, aged care we know is simply a product of demographics. We've known for years, if not decades, that the ageing of the baby boomer generation and then every generation after them, because they're all big, my generation's bigger than the baby boomer generation, is going to mean additional costs. And you invest in that in the same way that during a baby boom itself, you invest in schools. This is the right and proper thing to do. So to an extent, there of course is going to be an inexorable rise in the costs associated with supporting a generation that worked hard, paid their taxes, raised their families and built this community. And we should just recognise the reality of that. The intergenerational report that comes out later this year will set out some of those numbers again to refresh our understanding of it. But yes, this is inevitable in the ageing space. But we've got to make sure we spend the money right. We've got to make sure that we get a sustainable mix about who is funding this. That's something we're giving consideration to now. In the broader health space, I think if you look at PBS, for example, after the pricing reforms that were put in place 15 years ago, the expectation 20 years ago that PBS was going to overwhelm the budget just hasn't come to pass. So growth in the PBS is relatively modest. Growth in the MBS, the Medicare benefit schedule, has been relatively modest. Growth in health that is substantial is in hospitals. And so obviously we're talking with states about that. We've got a midterm review of the hospital funding agreement that's just kicked off. All of us want to make sure that every dollar we spend in health is spent wisely. We've got to look out for inefficient, non-productive uses of scarce health funding and make sure that it's being used in the best way. But I think in a whole lot of areas of health, we've managed to control spending pretty well. In some areas, particularly associated with ageing, there is going to be an inexorable rise in per capita spending for an older population. But again, we've got to make sure that that's done smartly.